the opioid epidemic is affecting all parts of our country, rural and urban, white and communities of color, and rich and poor. And that's something I've seen firsthand as I've traveled around the country. And that's one of the things that we have to help people understand is that addiction is a disease that does not discriminate. It's impacting everyone right now. And that's why we need all parts of our community to come together to help solve it. I really do believe that the prescription opioid crisis is one of the most important public health crises of our time. Well, I think there are at least three big forces that are contributing to the prescription opioid epidemic. One has to do with prescribing practices. About 20 years ago, clinicians were urged to treat pain more aggressively, but weren't necessarily given the support or training in how to do so safely. We've also seen that there's been a dearth of treatment centers and facilities available. So even people who are living with addiction that's identified have a difficult time getting help and getting treatment. But third, we have a challenge with how we think about addiction in our country, which makes it hard for people to come forward and to get help. Many of us think about addiction not as a chronic disease, but we think of it as a character flaw or as a bad choice that people made, as a moral failing. And we have to change that. We have to help the country see that addiction is not a character flaw, but it is a chronic illness like diabetes or heart disease. If we help people see that, it'll make it easier for folks to come forward and get help. It'll also make it easier for communities to support treatment programs in their neighborhoods. And right now, that's a challenge for many communities who look at addiction and treatment centers as a source of bad people, who will unfortunately come to their neighborhood if a center is built.